I am Dr. Neeraj Jain. I am working as a consultant rheumatologist at Sir Ganga Ram Hospital, which is a multi-specialty hospital in heart of New Delhi. Rheumatoid arthritis is an arthritis which is inflammatory in nature. It is an arthritis of young population. Mainly it occurs at the age of 20 to 40 years, and it affects women more than the men. And it is basically arthritis in which the small and the large joints are affected. Rheumatoid arthritis is diagnosed on two bases. One is clinical and one is the laboratory basis. In clinical, you have to see the patients may complain of pain and swelling of the small joints of the hand, the large joints of the hand and the legs. And then you have to do some investigations like routine investigations plus inflammatory markers, ESR, CRP. And there are some specific tests for rheumatoid arthritis. They are rheumatoid factor and anti-CCP, which needs to be done, along with X-rays of the hand and knee if required. See, there is no clear-cut causative factor for rheumatoid arthritis, but it may have some familial incidents, sometimes an environmental stress or some bacterial, viral triggers. Sometimes stress can start the inflammatory process. Treatment are twofold. One is the normal conventional treatment in which we have oral tablets, and another one is the biologic treatment. So all patients who are diagnosed as having rheumatoid arthritis are started on conventional oral treatment, which are known as disease-modifying anti-rheumatic drugs. The drugs are like methotrexate, hydroxychloroquine, sulfonamide and leflunomide. And plus, initially they may be given some non-steroidal anti-inflammatory drugs plus short course of steroids. And then patients can be followed up 1 monthly, 2 monthly and 3 monthly basis. And then later down the line, if patients are not responding, then we can discuss about taking biologic treatment, which is the more potent drugs. They are different class like anti-TNF drugs, infliximab, etanercept, adalimumab. And then you have anti-CD20 molecule like rituximab. And then you have abatacept, which are known as a biologic treatment. It has been advised that all rheumatoid arthritis patients should be very active, because this disease gets worse when the patient is taking more rest and is very inactive. So we ask patients to go for morning walk, keep themselves active and avoid unnecessary rest. And then since this disease is a disease of long duration, so patient may have other comorbidities like diabetes, hypertension and dyslipidemias. So if patient has diabetes, then he need to avoid sugars, blood pressure and cholesterol needs to be very much controlled. And when these patients are on long-term treatment, they are steroids, then their bones can get weak because of osteopenia or osteoporosis. So these need to be given calcium and supplements, which should be very regularly taken by calcium and vitamin Ds. And some patients may develop deformities, so they have to avoid any work which causes a lot of stress on their joints, so that the joint progression is halted. Not lose hope, because initially many years back it was said that there is no treatment for rheumatoid arthritis. Now I will say that there is a very wonderful treatment available with us for rheumatoid arthritis. Though we can't cure rheumatoid arthritis, but we can achieve a near cure, or what we call as a very tight control for rheumatoid arthritis. And all patients should live happily.